All right, let's get started. Welcome, everyone. Thanks so much for joining today's webinar. Today, we're going to be discussing how Jefferson Health builds a strong nurse workforce through virtual and emeritus nurse programs. My name is Iman Abuzaid. I'm an MD by background. I've been in technology for the last 10 years of my career, and I'm the CEO and co-founder of Incredible Health, which is the fastest growing career marketplace for permanent healthcare workers. Incredible Health is the only platform that enables hospitals to apply to nurses instead of the other way around and enables them to hire permanent and experienced nurses in less than 20 days. We flip the script, so hospitals and health systems apply to nurses and not the other way around. Joining us today is Kate FitzPatrick. Kate is the Executive Vice President and Chief Nurse Executive at Jefferson Health in Pennsylvania. Jefferson is an integrated nonprofit health system with 18 hospitals throughout Southeast Pennsylvania and Southern New Jersey. Its academic anchor hospital is Thomas Jefferson University Hospital in Philadelphia. Jefferson Health also has multiple magnet designated hospitals, including Thomas Jefferson University Hospital, Jefferson Abington Hospital, Jefferson Einstein, Jefferson Health New Jersey, and one-way pathway designated hospital in Lansdale. In addition to being the Executive Vice President and Chief Nurse Executive at Jefferson Health, Kate is also a Professor and Associate Dean for the Jefferson College of Nursing. Before joining Jefferson, Kate served as a Senior Vice President and Chief Nursing Officer at the University of Vermont Medical Center, where she was also the Associate Dean for Academic and Practice Integration at the University of Vermont College of Nursing and Health Sciences. Kate currently serves on the Finance Committee for the American Academy of Nursing. She is also a Magnet Program Appraiser with the ANCC, and we're so thrilled to have you today, Kate.
Thank you so much, Aman. I'm delighted to be here.
Fantastic. So this is designed to be an interactive discussion. Please, for those of you in the audience, please feel free to submit your questions in the chat anytime. We'll answer some of them as we go along. And then we've also set time at the end for Q&A. And this entire webinar is being recorded and it'll be shared with you. A member of the Incredible Health team will be in touch to share the recording with you afterwards as well. So today we're going to be covering a few topics. One is just going to get the lay of the land of what's happening in the nurse labor market today, not just in Philadelphia, but across the country. We're going to be covering innovative hiring strategies and retention strategies like the virtual nurse and emeritus nurse programs. We're going to go deeper on retention strategies that nursing leaders are implementing these days. How Incredible Health can help, and then also Q&A. All right, let's start with a market overview. So let's set the scene, set the stage for what's going on today. So nationally, what's happening is our demand for healthcare as a country continues to increase because our population is aging. But we as a country have not done a great job of increasing the number of healthcare workers, especially nurses, to meet that demand. As of 2018, healthcare became the #1 labor sector in the country, employing the most number of Americans compared to any other industry, and 1 in 8 Americans works in healthcare. These are some recent data that we have. We're on track to be 1.1 million nurses short by the end of the year nationally. The average annual acute care nurse turnover right now is at 18.7%. There are some regions in this country where it's even higher than that. We're also seeing labor costs continue to increase. So right now for publicly traded hospitals, 48% of revenue is being spent on labor. And interestingly, it's not just the temporary labor costs that are driving this cost up, but even the permanent labor, the permanent nursing labor is, their wages are increasing. So that's increasing costs too. And then finally, the time to hire, the national average right now is at 89 days to hire a permanent and specialized nurse in an acute care setting. All right, the next thing we wanted to just briefly share is why are nurses leaving? Why are nurses changing jobs? What's driving that high turnover? When nurses sign up for Incredible Health, they are often asked, why is it that you're considering a new job? And we have 1 in 4 nurses in the country who on our platform, on the Incredible Health platform, that use it to manage their careers. By far, the #1 reason that's cited is they're looking to advance their career. They're not able to advance their career for a variety of reasons at the current health system. And so we're really excited to talk to Kate today because she's put enormous efforts into career advancement programming for nurses. The second most common reason is they're looking for a more flexible schedule. And then so essentially the days of 3 days a week, 12-hour shifts, full-time only or over. And more health systems are presenting a menu of options because it is what the nurses are looking for, particularly those that are Gen Z and millennial nurses. The third most common reason that's selected is something to do with geography. Either they're trying to reduce their commute time or they're trying to relocate altogether. And our data shows that there's enormous relocation happening in the permanent nurse labor market, where about 1/3 of the hires on our platform are relocating to a different state. And then the fourth most common reason selected is looking for more pay. All right, with that in mind, I definitely just wanted to just share just a very recent survey data. This is less than a month old, around what are the top concerns from nurses. A huge percent are concerned about the shortages on their units. There is 70% concern about burnout, 68% concerned about salary and benefits, 45% concerned about work environment, 30% referring to scheduling concerns, and then 25% referring to career advancement. This is just in general, what are their top concerns, not necessarily specifically asking about why are you considering a new job. All right, I'll pause there and turn it and would love to welcome Kate again. Welcome, Kate.
Thank you so much. Wow, those are just profound statistics. Easy to get depressed and down when you look at sort of where we are. But one of the things I want to say just as we get started is I have tremendous hope.
Yeah.
And if any group of professionals can find their way out of the challenges we're in, it's nurses.
You're absolutely right. We work with nursing leaders across the country, and this is kind of one of the best times to be a nursing leader because it's a time for innovation and change, and nursing leaders are getting the support from the CEOs and CEOs of the health systems too to solve this challenge. All right, so Kate, we'd love to just start with an overview of, just from your perspective, what are some of the top nursing challenges that you're facing at Jefferson?
Yeah, I think the one I would lead with is it's actually a universal challenge. And I think what we've experienced across the globe is a significant trauma to humanity with the pandemic. And, with that, there's been fear, anxiety, we had lockdown, there was forced isolation and separation. And then when I think about healthcare teams, we've witnessed at levels we've never seen before, human suffering and death. We've seen just all kinds of things that come from being isolated and being separated in terms of exacerbation of really important social issues, but also mental health and, spiritual issues that have surfaced for people. So I think I start with that because everybody in our workforce in healthcare has experienced those things. We've borne witness to these significant things. There is this significant trauma that I believe we haven't had a chance to even process yet. Then as you layer on top of that, I'll just talk about our experience in Philadelphia. We are in an extraordinarily competitive market. So we've got some fabulous premier academic systems in very close proximity. We also, like others in the city of Philadelphia, despite lots of effort, continued full-on focus, we continue to have challenges with safety in and around our hospitals. And so, just this idea of workplace violence and what that's meant for recruitment and retention is real, and it's significant. We've also experienced, like, many other institutions across the country, just transitions in generations in the workforce and the tensions that brings. But for me, it's also amazing possibility, but it also has presented some challenges. We're losing a significant brain trust with the nurses who are retiring, and they're retiring in rapid numbers over the next several years. So how do we bridge that complexity experience gap? And how is that part of the workforce plan? And then you mentioned it, I think what we're seeing from some of our younger staff and our newer graduates in nursing in particular is this desire for flexibility, right? So what has been the traditional model in healthcare around staffing, around how we structure positions? Like, we've got to blow that all up and say, let's reimagine it. And I think that's what we're all trying to do across the country. So I would say finally that one of the challenges we have is pipeline. Our pipeline, and I'm sure many of my colleagues on the phone have the same experience, has been primarily inexperienced, new to practice nurses, and they're coming into a very complex environment. So our challenge has been getting experienced clinicians at the bedside. And I think that's one area where I will say that Incredible Health has been very helpful to us in particular. So those are just some of the things, but I think that's probably enough of a frame to keep us, get us going.
Absolutely. So I guess the follow-up question is just at a high level, how are you thinking about addressing some of these challenges? And then we'll go deeper on specific topics.
Yeah, I think we have a workforce optimization strategy, and we've been very intentional about it. And, one of the things that I think has served us well at Jefferson, we actually started and created the foundation of that before the pandemic hit. So I think it was incredibly important to us as we navigate, these white waters we're swirling in right now, that we had that foundation. And we were very focused on how do we join forces as nursing leaders, nurses across 18 hospitals. At the time, it was 14 hospitals in 2019. But how do we optimize the resources and really think about this as a united front? So we're not all trying to solve it and compete amongst each other. So we did a lot of intentional work around that issue in and of itself. Pay practice alignment, titling alignment, looking at bonus and incentive program alignment. So those things were really, really important. But I would say in general, our workforce strategy really is focused in three key areas. It's about building an effective pipeline. It's about how we effectively utilize and deploy our teams. And then how do we, in a very meaningful, very intentional way, invest in our people? So the things that I would talk about would fall in those categories. And I'll just give you a couple of examples in each. And I'll pipeline. We've got a couple of different things that I'm really excited about that are in flight as we speak. One is a program in our northern region where our chief nursing officer has partnered with a Catholic high school, St. Hubert's. They are looking at an LPN program that also has a pathway to have those students have exposure to and experience in our hospitals in the North region during that time that they're going through the LPN program. But it also gives them an intentional pathway into the Jefferson College of Nursing to continue to get into a degree granting program in nursing, which is really great. So that's early in its stages of coming together, but we need to do a lot more of that kind of earlier pipeline. The other example that I'll share is another key member of the team for us that we've had significant challenges with is perioperative nursing, and really looking at who's the team and how can we think differently about that. So we've really thought about our skill mix for perioperative care and really trying to grow our surgical tech as a role. And so we've launched an apprentice program in Center City. And one of the things I've been really just so excited about is how many of our current employees who were not in clinical roles have, found this as a pathway for them to advance themselves and take on a career that's a clinical facing career. So that's just been amazing. Again, still fairly new, but those are a couple pipeline things. I think in terms of effectively using our teams and deploying our clinicians and thinking differently about how we augment care at the bedside, there's two that I'll share. The first is virtual nursing. And I know many of our colleagues across the country are moving forward and have some great experience behind them already in the virtual nursing space. We've really thought about this as a way, and this is really important in our guiding principles, not to replace a nurse, but to augment the care that's already being provided and to entice nurses that may not want to be in the acute care space, but they can contribute in tremendous ways. And so we've had a pilot at one of our hospitals in the North region, Abington Hospital. It's on a surge unit. And so we're really excited. I know we're going to talk a little bit more about the details of that. The other effectively deployment of teams and thinking differently about building flexibility into our workforce plan is the example of our SEAL team, which is sort of the imagery of special forces. And it's really experienced nurses who desire flexibility in their role. We launched the team about a year ago, started with a goal to hire 30 in the initial phase. We now are on track to hire 150. I think we just hired our 110th nurse. These nurses are hired into different tiers. There's a tier that really focuses more on a region. And then there's a tier that focuses in terms of being able to go across the entire system. The way we've operationalized this is it's a pre-assignment kind of a model. It's not the in the moment fill in a sick call. We have some local teams that so those are two around effectively using and deploying our teams. And then finally, I'll just share a couple of examples about how we're investing in our teams and our clinicians, and particularly our nurses. We're going to talk a little bit more about the Nurse Emeritus program, but that's been an important program to help us position nurses who are retiring or who have already retired, who have this incredible brain trust that we desperately need. So having a pathway for them to contribute at the bedside, but in a way where they define the parameters. So we'll talk more about that. We have a clinical advancement program, which I know many places do. We've just moved to standardize that across the system. There's monetary gains as you climb the ladder, which is important, but it's also meant to help give nurses opportunities to contribute to quality and safety and experience work, and also support development of nurses at the bedside. And then last, and I think this has been an important strategy for us in terms of investment, is we launched the Jefferson Health Nurse Leader Development Program for our new to practice nurse managers. And there's criteria greater than 6 months in your role, but less than 18 months. It's a cohorted program where we have nurses from across the system, both from inpatient and outpatient and nurse manager roles. And they get a curriculum that's based on the AONE nurse or AONL nurse leader competency framework overlaid with our Jefferson leadership competencies. But that's been a tremendous program to help our new leaders who are stepping into enormously challenging roles. And they're so important in terms of retention and recruitment. So this investment in them, to me, is critical.
All right. That's fantastic. That's a very thorough strategy and tactics that you're putting into place. We'd love to just go a little bit deeper on the topic of utilizing your teams, right? And the topic of virtual nursing, which I imagine is touching retention as well, because it's a different way for nurses to get trained. Would you mind just sharing a little bit more about your virtual nurse program and how it works?
Sure. And I was really excited. I was at AONL a couple of weeks ago in Anaheim, and so many great that I attended with organizations who are further along in their journey than we are. And I think that's the other beauty about nursing, and why thank you, Iman, for this webinar, because one of the things for all of us to move faster is to share, and to share, very openly. And we certainly intend to do that. And we've learned a lot from others. But in our virtual nurse pilot program, again, it's in one hospital, currently about to launch in a second hospital, our Thomas Jefferson University Hospital in Center City, Philly. We have a model where we've got a remote hub where the virtual nurses work from. We have a camera set up in the patient room that has both audio and video capability, so a big screen in the patient's room. We have launched our pilot utilizing the SEAL team nurses. So we pulled out a couple of those SEAL team nurses to focus on this pilot. So we had some consistency, and we could really use nurses who were experienced and had sort of a broad base of what their clinical backgrounds were. So we were very intentional about who we chose for the pilot. The pilot to say, how can we measure and define what's most value add for the nurses who are working side by side, in air quotes, this virtual nurse, but also the patients and families. That was really important to us. How are they experiencing this? So we set up a process to get real-time feedback on the pilot. But what we've started out having the nurses focus on are things like admission and discharge assessments, supporting some of the electronic health record documentation, helping with medication reconciliation, helping with patient teaching, helping with safety audits, hourly rounding, those kinds of things that add value to the nurses that are at the bedside, that allow them to focus and spend more quality time on other things where, we hear time and again, and when we do time motion studies, how there's just not enough time for nurses to provide the meaningful care that they really, desire to provide. So that's a little bit about how we've gone about the virtual nurse pilot. We're learning a lot, and we're trying to adjust real time as we go through the pilot to, make those sort of real time tweaks and kind of hear the nurses and patients and families and meet them where they are, and move that into our second phase of the pilot. So we're very excited with our early experience with this.
Great. And then how are you planning to measure success? Is it what you described around admissions, discharge, EHR documentation? How are you assessing the program?
Yeah, we have a robust set of key performance indicators, and there's things like, of course, we're looking at, length of stay is one, and efficiency of throughput. We're looking at milestones against discharge, which is very much related to length of stay. We are looking at near miss events and safety events that we are capturing, catching. Timeliness of documentation, completeness of documentation. So those are just some of the things that we're focused on. And then similarly, looking at patient experience and starting to build our deck of what are the patient and family focused KPIs that are really going to be impactful here.
Great. And just, I know it's still early, but anything you can share about how patients and their families are reacting to the virtual nurse program?
I would say overwhelmingly, the feedback we've gotten has been very positive. I think in some respects, it's like this safety net that you've got someone there with you on a busy med surg unit with a nurse who can have 5-6 patients, and so this sort of, I've got a lifeline because I've got someone right there that I can engage with if I need something, so I think from a patient and family perspective, we're learning a lot more detail about that, but I think overwhelmingly very positive.
Right. So it feels, it's like almost more reassuring.
Yeah.
Yeah, that's great. That's fantastic. Many of the nurse leaders on the line today are looking for more innovative workforce solutions. Would you mind just walking through just how you set up a pilot? How you set up this pilot, but what you're saying is relevant to any pilots a nursing leader would want to set up.
Yeah, and I take no credit for this whatsoever. And most of what I'm talking about, I take very little credit other than to be like sprinkling the miracle grow and letting teams who are just uber qualified and innovative and have great ideas take things and run with them. So this was, a couple of my leaders on my team. So I want to mention our VP of Nursing Operations and Administration, Daniel Hudson. One of his leaders, our director, Andrew Thumb, at the system level, who does all things workforce. And then Laura Gartners, who's one of our nurse informaticists in the North region, and Colleen Malazzi, who's my chief nursing informatics officer. So that core team partnering with some of our team on the Epic side and with the tech side. One person I want to call out is Ed Dow. They were just this remarkable team who thought very intentionally about what's the right environment where we want to do this. We've got to have the leaders sign off on this, the local manager. We need a way that the other stakeholders who work on that unit would understand and be bought into this. The chief nursing officer and the executive leaders for that hospital. And then really making sure that our executive nurse leadership team at the system level, all of our chief nursing officers across the system, and I meet with them weekly, understood what was happening, could inform the pilot with the idea that eventually we want to scale this, right? So one of the things we did was be very intentional about the unit and then be very intentional about the nurses. And so we chose to use 2 of our, SEAL team nurses. And I think that's been helpful. I think engaging the local nurse informaticist team, understanding how we could leverage, give access to the SEAL team nurses around what they're seeing in Epic and how they can, how they can support the nurses at the bedside. And then I think really important, we used in our pilot existing technology, and we're actually reviewing what's the optimal technology. We don't have an answer on that. But I think, one of the things we thought just so we could get speed to execution was use an existing platform that we already had in the hospital. So that's what we chose to do. And then I think the last thing to mention just in terms of logistics was how we set up the easiest way possible to get real-time feedback, which was set up a barcode scan option for both nurses and patients and families to in the moment give us feedback. So Laura Gartner and Andrew Thumb and others on the ground could really work with what they were hearing and make adjustments, real time.
Great. And how did you pay for it?
So we paid for this first pilot through our own operating dollars.
Okay.
The second phase of the pilot, I actually have philanthropic dollars that are funding the second wave of the pilot from a grateful patient and family from Center City. So, I think in these challenging times, this is where it really gets difficult. It's a great idea, it's value add, but there's so many other things that are really being scrutinized, and you're up against things that are really important and really powerful. And it's like, how do you make the right decision? So I'm committed to keep going forward. If we have to keep getting philanthropy, I'm going to look at grants. We'll do what we need to keep this going, because I really firmly believe in this as a strategy.
Great. As far as the business case goes, for this program, is it primarily around the improvements in the KPIs you mentioned earlier, or like how are you thinking about the actual ROI program?
I think if I just take a step back, I think there's a couple of things. We hear from our nurses that in this time when we've got such significant workforce shortages and their idea of team has been disrupted because there's been so much turnover, and we've had transient, very, grateful that we've had them, but we've had travelers. So the sense of team has been disrupted. So trying to recreate that sense of team by having a team that might look a little different, but it's positioning nurses in roles that we can attract and retain them in because they're looking for a different way to provide care. So again, we think of this as an augmentative role to the existing team that lessens the burden. So for me, it's about the experience of the nurse at the bedside and how can we help alleviate some of what's burdening them. That's one thing. I think the other is, again, around patient and family experience and other key things that we've already talked about, but we feel like it's a much more supportive environment, that they feel like there's eyes on them and someone available to them in a much more rapid fashion. I think that's where I think it's really exciting, in addition to things like being efficient with throughput and being efficient with timeliness of documentation and some of those other pieces.
All right, fantastic. I'll just take a quick question from the audience about this topic. Would you be open to sharing or thinking or sharing how you thought about the ratio of virtual nurse to patient?
Yeah, and I think in the pilot, part of our objective was let's explore that with open mind. So we didn't go into it with like, we're going to have, this is what that's going to be. I think part of what we're going to learn, what we are learning, and actually what I heard at AONL is, it's what I said at the beginning, this virtual nurse is not a replacement per se, it's helping us redefine the work and do it differently. I think we're going to continue to get pressure to say, well, how do we do this with less nurses, right? So it's for us to add and be very specific about and intentional about how we show the ROI in all these other areas that allows us to keep making the investments in what we know to be sort of the right direct care hours per patient day in these various settings. And we look at things like productivity. And so I think, I'm curious, there's a lot of things that I think we're going to learn as we get deeper into this about how we think about, ratios or how we think about the care team configuration. And I'll just mention, because I think it's important, virtual nurse is not the only thing that we're going to be exploring around care team model of the future. So. Yeah.
Absolutely. Thank you, Paula, for the question. Okay, let's go to another sort of strategy that you're implementing, and that's the Emeritus nurse program.
Sure.
Would you mind just sharing a little bit more about how you're thinking about that and what's the purpose of it and how you're putting it together?
Sure. I really give credit to one of our chief nursing officers, Dr. Helene Burns in our New Jersey region, who, thought about like, we have a mantra on our team when it comes to workforce, like leave no stone unturned, right? So, whether she heard about this at a forum, Someone mentioned it to her. I can't remember the genesis, but we had this idea. How could we optimize retired nurses to help support, the clinical burden that we know our nurses are experiencing right now? And so what we did was we had an intentional outreach to nurses who had retired within the last 3 years, offering them to explore an opportunity. And we started with one track, which was clinical support. And I'll come back and talk a little bit more about how we structure that. But then we have 2 tracks now where there's a leadership track, which is broad, and then the clinical track. So the leadership track includes nurses who might have retired in roles like as nurse informaticists, nursing professional development specialist. We just hired our first retired CNO from one of our hospitals in the North region, who she retired in January and she came back in April, and she's going to do a lot of frontline nurse manager development. She's also been helping us with our recruitment sprint. So much possibility. But the clinical track, emeritus nurses, there's a set pay rate that we've established for both of those tracks through HR. We have a way that we keep a master tracking of where we have needs through that leader, Andrew Thumb, that I mentioned. Helps deploy, where we're going to utilize this resource with the CNE, the chief nursing officers in the regions. But the clinical nurses really come in as a supportive kind of float function. They are not taking a patient assignment. They're there during strategic times, like so we can relieve people for meal breaks, so that we can do change a shift more effectively. Maybe there's some teaching that has to happen and we need to get nurses off. Can we have one of the emeritus nurses step in and help cover patients with the team there and be an extra set of hands? So that's how we've thought about it. Again, we're just probably coming up on a year. We started out with 5 or 6 in New Jersey. I think we're getting closer to 10 or 12 of those, and starting to expand some of those in the leadership track.
Great. And so, nursing leaders across the country have tried to bring retired nurses back with mixed success, right? So what do you think was, what do you think has motivated these retired nurses to come back? Like, what is it, just from their perspective, what motivated them to consider this program?
Yeah, I think it's very personal. I would say, if I start with the chief nursing officer who worked on my team, Dr. Marie Papa, one of the things I think she still has so much to contribute. And I think she has so much energy. She has the energy of a 20-year-old. And so we need that. And she's got this brain trust. And I think she really wanted to be able to give back and contribute. And, she's getting some income too, right? Which is great. It's also very important. I think we joke, she didn't retire. It's like her preferment. She can define her, the parameters of her time that she wants to give. I would say for others, I probably don't know all the deep details for each individual, but I would say global themes are, people didn't necessarily want to leave at the time they left, but, it was stressful and it was not feeling like they could contribute the way they wanted to. And so this gives them a pathway that gives them much more control. And they see clearly that they are adding value when they are working alongside, a new to practice nurse in their first couple of months. And they have this, senior level person who's been at the bedside for decades, being able to help them and coach them and just be a resource. So, the retention part of this is great. I think it's a personal fulfillment and satisfaction for the nurses who choose to do it. There's a flexibility there. There's the income piece. I don't think anybody I've heard leads with that. That's just like, actually, you know what I mean? But so I think we're going to learn a lot more, but I'm really thrilled with this program. And I think there's a lot of areas we haven't even tapped yet where these emeritus nurses can add value.
Awesome. My follow-up question, and I asked of the virtual nursing program as well, is how did you think about the business case or the ROI for the Emeritus program? The reason I keep asking these questions is there's phenomenal nursing leaders across the country, and at the end of the day, they do have to make a case with dollars and cents for some of this program, for a lot of this programming. So that's why I keep asking. So how do you think about the business case or the ROI when you're making these decisions or discussing with your finance leaders and so on when it comes to these programs?
Yeah. Well, I would say this, Aman, and you're exactly right. My office happens to be right next door to the CFO for the system. He'd be really proud of you that you keep pushing the ROI. And I would say it's in multiple domains where we experience the ROI. And, we can start with the obvious one around the finances. We've set up all of these emeritus positions as per diem positions. So, when you think about for the nurse leaders on the call, that's pretty straightforward, pretty easy to do. And you can control, to some extent within your parameters. We have such vacancy rates right now.
Yeah.
It's where we see the ROI is in the retention, in the support, in the avoiding of a quality and safety event, in the avoidance of a bad patient experience event. Those are the things that we really need to quantify, when we have much more experience under our belt. But those things, some of those are a little harder to measure, right? But I do think they are critically important. I mean, they're the kind of the soft ROI. But I think the way we've structured this, there's not really been a hard sell here. We've got right now at Jefferson somewhere across, in the neighborhood of about 800 open positions across the system for registered nurses. So having, 12, 15 per diem positions of emeritus nurses, if we can even say that some of that would obviate the need to think about a traveler in a location, how much that costs. So
Yep.
Those are the things I think getting more specific about how we quantify that is really important.
Great. So for the you have 12 nurses in the Emeritus program right now in this soft launch. And what has been some of the, I guess, early results of the program?
Yeah, and I would say for this piece of our workforce optimization plan, I would say it's pretty much purely anecdotal. We don't have hard things where we can measure, just because it's not, we don't have exact case uses of how these nurses are being deployed, right? So some of it is a one-off situation. What I can tell you is some of the most powerful feedback is from the newer to practice nurses who've had the opportunity to walk and work alongside an emeritus nurse, and how much they felt like they could get support and answers and guidance. These things, again, are hard to put a price tag on or hard to quantify, but that's where we're getting the signals to say we've got to keep doing this, because we have areas across our system where we've got all new to practice. I mean, the experience average is, less than 2 years on a number of units. We have the cases where we've got travelers orienting people. That's happening. And so when I think about that, that's where I go back to what's the ROI, why is this important? And, I think we're going to have to continue to really be more specific about what impact they're having. And that is absolutely our desire and our goal to do that.
Great. So let's take a step back to the overall topic of nurse retention. Honestly, Jefferson Health's turnover is certainly better than the rest of the country. Would you be able to open to sharing your nurse turnover rate?
Yeah, so we've hovered, somewhere between the 18 to 20% turnover. We've seen it come down, and we're thrilled about that. I would say also one of the advantages of that flexible SEAL team we mentioned is the experience we've had of hiring back nurses who left us to go travel. They didn't want to leave Jefferson. What they wanted was the flexibility, and they wanted to, have some higher dollar pay options, and we're paying them for that flexibility. So I think, we've done well with turnover rate. It's a constant battle, right?
Absolutely.
And so it's a constant fight. And we've done a lot of things to really be specific and intentional about that. And I think it starts with hearing the voice of the nurses about what's going to keep them here. And I know in many of the areas across the system, we're doing stay interviews and trying to be proactive about what's keeping the people that are staying here. How do we optimize that and scale and spread that? We've done a number of things in terms of other retention strategies, starting with, I mentioned workplace safety as a top priority. it is critical. And, we see one example after another in the popular press. We certainly see it in our professional sort of streams of information. We've got to do something different. Our nurses should be able to come to work, any clinician, and expect to be able to deliver care safely. Like that has to be a given. So we do have a health system committee on public safety. We've hired a new leader who actually ran the Secret Service detail at the White House. He is a game changer. He is my partner. We've decided that clinicians, so as a clinical executive, I have to partner with him and own it equally. This isn't all just about its securities problem. We all have a stake in this, and we've got to come together on it. So we've got frontline direct care nurses who sit on this system-wide. And when I say system, our university is represented on this, our health plan is represented on it, and the health system is represented on it. All three legs of our system and enterprise. We have a lot of things that are launched and being launched around staff well-being. And we just hired probably about 3 or 4 months ago, our inaugural nurse manager for nurse well-being. And she is operating now in one of our regions doing sort of a demonstration pilot program, but we're going to scale her accountability to lead at the system level on this. And there's an infrastructure and a leader for physician, for APP well-being that's going to be a key partner. And then we've got leaders in our HR team who are really overseeing the overarching strategy here. And we're using the SAMHSA framework, that's really goes through 6 or 7 domains of, it starts sort of like Maslow's hierarchy. It's your physical, it's your spiritual, it's your finance, it's all the pieces of what makes you whole as a human, and trying to have strategies that address each of those. And we've started with just 2 of those, which is the occupational and the physical. So a lot happening there. I'll just share 2 things that I think are really, again, all credit to the team that I work with. I take no credit whatsoever, but we have music therapy for our staff, and we're doing this under a grant from the Hospital Association of Pennsylvania. And we've got a music therapist who goes into units and provides just this remarkable, it's not performative, it's really different. It's a way to help set a different tone and help ease a stressor or read the vibe on a unit and provide music therapy. Allie McCrae is our music therapist, and she's terrific. So that's one thing, but we've also really spread and been more intentional about our pet therapy. We actually, in our Jefferson College of Nursing, we have Maggie, who's a yellow lab. She's our chief compassion officer, our canine chief compassion officer, but she has a regular rounding schedule, and she goes around to all 18 hospitals. So it's incredible. And I'll just share one anecdotal story if I can on is some people on the call may know from reading in the newspapers that about 1.5 years ago, we had one of our employees shot while on duty inside our Center City, Philadelphia hospital, and he was killed. He was killed by another employee. And that happened on night shift. And we've learned a tremendous amount from that. And I'll say, the scars and the reverberations from that are deep. But a week later on night shift, a whole team of us came back because we wanted to do something intentional. A lot of things happened immediately, but one of the things we did is we brought Maggie in on night shift to be part of this gathering for the team who was on duty that night.
Yep.
And I just saw people's physical demeanor change. I saw their facial muscles. It was incredible to watch it because what a trauma they had been through and witnessed. So I think there's so many creative things that I'm seeing happen across the country. We're really excited that we have the ability to do both the music therapy and the pet therapy. And then I'll say a couple of things. We've got a great clinical investment program, as I've mentioned, and we're doing a lot of investment in nurses at all levels to do external training development opportunities through the AONL fellowship, through ACHE and fellowships they offer. So we're, one of the things I've been lucky about is I'm in an endowed position. So I have these restricted funds that I can use however I want. And in a time with no operating dollars, it's been really great for me to be able to sponsor nurses. Like we had 14 nurses go into a program that's run in our College of Pop Health. and it's women in academic healthcare. And that was an academy. And there were 2 different cohorts, but I had 7 nurse directors in each cohort. And I couldn't have done that without having some dollars, that had some flexibility to them that I could use in that way. So those are just some of the things.
That's fantastic. So you
Oh.
have a multifaceted strategy with retention.
Can I add one more?
Yeah, go ahead, Kate.
Because you and I talked about, I think this is really critical.
Yep.
The other thing here, and I'm speaking about it last on purpose, because it's about pay. And I have been very intentional with my team on having a regular cadence that we do equity assessments of our nurse pay in our all of our hospitals. We have 1 hospital that is in a contract. So aside from that, we're looking at pay every, we have a regular cadence where the comp team is evaluating the market, looking at how we're comparing and making sure we're competitive. So we did a sizable equity adjustment for all RNs in May of 2021. And then in January of this year, everybody across Jefferson got a 3% increase. And then we're about to pay out a 5% increase for registered nurses who meet eligibility criteria up to and including nurse managers in June. So those things are important because all these factors matter.
Yep.
But you've got to stay competitive, especially in a market like this where it's highly competitive and people have options. So just try to make sure we're positioned in a fair and equitable way so that people will look at us.
Absolutely. So, your retention strategy and tactics is very centered around what nurses are looking for and why they're staying. So you mentioned your career advancement programs and training, which Jefferson Health honestly has very much excelled in, particularly compared to your local competition as well, which is phenomenal. You mentioned compensation and maintaining equity. I'm curious to hear about your thoughts on flexible scheduling. One of the challenges we all have is we have 5 generations of nurses in the workforce today, from Gen Z all the way to the baby boomers, right? And who all have different needs and different desires. And flexible scheduling is becoming more and more prominent from the younger generations.
Mm-hmm.
So what's your sort of philosophy on that topic?
Yeah, I will tell you that the chief nurse on our team have embraced flexibility, I would say even before the pandemic, but they've gotten much more focused on understanding and really supporting all types of different ways that we think about shifts. I heard something really interesting, and I think it was at AONL. It may have been at another meeting that happened before that, but it was this idea that some organizations are even piloting something like a teacher schedule where nurses can work 9 months out of the year and then have the summers off with their kids who are out of school. So I think, as I said, we're trying to leave no stone unturned. We've got to be optimally flexible and balance that with providing safe, consistent, quality care, right? And so I would say that one of the best ways we think about some of these options and what's going to work is to involve the clinical nurses who are involved in the care. That should be the first group that informs what we're going to do and how we do it and how we go about it. They know better than anybody about how this can work. And so I think it's a partnership, and so we've tried to make sure that we're informing our strategies with voices of nurses in all different levels of positions. But I'm a huge fan of looking at flexible shift lengths and ways that we think about how we think about weekends, off shifts. There's so many things that we can do here. And I think it's kind of a requirement in this day and age that you have some flexibility in your strategy.
Yeah, absolutely. So what we'll do next is do a quick overview of Incredible Health, and then we'll spend the rest of the time on Q&A. Kate, something to think about is, I always ask every presenter this: what are your top 3 tips for the nursing leaders on the call that you want to end with? So I'll let you think about that. So Incredible Health is used by Jefferson Health, and we've also included in this presentation a little bit of data where we got Kate's permission to share as well. So Incredible Health, it's used by hospitals and health systems across the country. They use our technology and our custom matching technology to hire high quality permanent nurses in less than 20 days. All of the health systems on our platform use Incredible Health for experienced nurses, including the Jefferson Health team. But we also have about 40% of the employers using us for new graduate nurses too, because even the new graduates we can't take for granted, and they're not necessarily easy to hire in every part of the country either. We work with over 700 hospitals and health systems. We are a software company that's headquartered in San Francisco, but we operate in 27 states. We work with very large health systems like HCA Healthcare and Tenet. We work with big regional systems like Baylor Scott and White and Wellstar, and many academic medical centers as well, including Stanford, Johns Hopkins, USC, and several others. As far as what it is that we do, there's a few unique things about Incredible Health. This is a very nurse-centric or candidate-centric platform. The first is that the employers apply to the nurses instead of waiting for the nurses to apply to them. So as you can imagine, the nurses absolutely love that. They create a profile, they sit back and relax, they get interview requests from different employers, and the nurse gets to choose which interviews to accept and which ones to decline. We've also done some level of pre-screening before we put the talent in front of Jefferson Health's talent acquisition team. We also have custom matching. So it's important, nurse recruiters are very busy. So it's important we put the right nurses in front of the right recruiters, and vice versa. If you're a highly sought after OR nurse, you don't want to hear from 100 employers. You want to hear from 4 or 5 that are the right fit for you. And then because our two-sided marketplace is powered by software, we have tons of data analytics. So we're able to share data on how a health system is doing compared to its local competition and its national competition. And it helps nursing leaders and HR leaders identify bottlenecks and ways to continue to improve their operations internally too. As far as just the nurses side, we offer, how do we get so many nurses on our platform? We have 1 in 4 nurses in the country using Incredible Health now. And the answer to that is we offer them lots of free services and tools. We offer free continuing education to every single nurse in the country. We have free salary estimators for nurses. We have a community of nurses built into both the iOS and Android apps where nurses can ask advice from each other. And every nurse on our platform gets access to a career coach that helps them with interview preparation and helps them evaluate offers as well. Just want to share the need for speed in nurse hiring. Our data shows that 68% of nurses accept the very first offer they receive, and 61% of nurses accept the very first offer, even if the second or third offer has higher compensation. What we're seeing is that in every market where we're in is that the hospital and health system that has the fastest hiring operational speed hires more than the hospital with the highest compensation and hospital with the biggest brand in that local market. And I know these are efforts that the Jefferson Health team has worked extensively on to accelerate, which is great. We're ultimately trying to reduce the days to fill from 66 days down to 19 days, and where we have the biggest impact is on time to source. And then we also track retention. The retention when a nurse is hired through Incredible Health is about 15% higher than the hospital's baseline. The reason for that is the nurse was able to consider multiple opportunities before selecting this hospital. So it was a very well thought out job search. All right, we work with the Jefferson team. These are roughly say 8 steps in the hiring process. This is a true collaboration. It's a true partnership. We're doing Incredible Health is doing a lot of the heavy lifting in the first 4 steps. So finding those experienced nurses, sourcing them, making sure they're actively looking, and getting them custom matched and scheduled with the Jefferson Health recruiters. At that point, the Jefferson Health team is taken over, and the nurses entering the normal hiring processes, completing that phone screen with the recruiters, completing interviews with hiring managers, and getting offers out and accepted. It takes both parties to make this successful. Incredible Health does not employ any recruiters, so the value we're driving is with service and software. And this is a newer model in talent acquisition. We talk a lot about nurses operating at the top of their license. We need nurse recruiters to operate at the top of their skill set too, which is speaking with candidates, building relationships with hiring managers, and some of this more administrative work like sourcing can be done by software like Incredible Health. All right, so just want to share a little bit of Jefferson Health's data. They've been using our platform for over a year now, almost a year and a half now. The nurses that they have hired through our platform have an average of 8 years of experience, which is important for the Jefferson Health team because they are trying to increase the number of experienced nurses in their workforce. They have been able to dramatically reduce their speed to hire from it was over 60 days before, over a year and a half ago. They got it down to 28 days, which is phenomenal. And then the return on investment for their Incredible Health investment is over $2.5 million. Essentially, by hiring permanent nurses faster, the Jefferson Health team is able to reduce travel nurses faster. And that drives millions in savings for the Jefferson Health team. And probably one area where we've seen dramatic improvement that, collaboratively we've done together, the Jefferson Health team and the Incredible Health team, is really reducing the time to offer. They got it down from 16 days down to 5 days, and they're now working on same-day job offers, which will help them hire even more. Anything else you want to mention, Kate, just about your hiring operations and what you're doing internally to keep making this better?
I would just say, I wanted to reiterate what I said at the beginning around where I think that Incredible has been really helpful to us, specifically is around getting experienced nurses. And that's been such a challenge. So I think that's been one of the real specific value adds for us, in addition to everything else you just highlighted.
All right, fantastic. Let's go to Q&A. If anyone in the audience is interested in Incredible Health, Danny's shared our link. You can sign up for a consultation. Happy to support more health hospitals and health systems. Okay, so we'll take a couple questions from the audience. Well, this is a very specific one. What platform are you using for your virtual nursing pilot?
Yeah, the existing technology that we already had in-house was Avasure. Many people are familiar with that. Their typical context is one-to-one close observation. They have remote video monitoring for that context, and that's what we did the pilot with.
Awesome. Thank you for your question, Monique. This is a question from Shella. You mentioned this a couple times, Kate, about the person who's really supporting you with your retention strategies and making nurses happy in the workplace. Can you share more about their background and this role?
Yeah, so there's actually two people I want to highlight in terms of roles that we've put in place. So the one I mentioned specifically was our inaugural nurse manager for well-being for Jefferson Health, or for the Jefferson nurse, as we say. Her name is Kristen Gilmore. She was one of our clinical nurses in our Center City division at Thomas Jefferson University Hospital. As I said, we launched this pilot in our North region. Our chief nursing officer in that area had gotten a philanthropic grant through their foundation board to stand up this nurse wellbeing program. And part of that grant money has funded Kristen's position. She's been looking at frameworks, things like the AACN healthy work environment. So assessing and understanding, we just did a system-wide, or actually an enterprise-wide employee engagement survey. So we have a lot of rich data now. We're looking at that to help us target some of the strategies. So what she is going to focus on, Kristen's focus will be on thinking about and identifying the things that are meaningful to nurses that help support them and their own well-being. And that's going to be a multi-pronged strategy. And it definitely will be informed by specific feedback through formal survey, like the engagement survey, but also ways that she can do that in a more real-time basis. And those are the kinds of things that we want to grow. The other role I wanted to mention just briefly is we have a nurse who we hired in a temporary director position over a year ago. The hospital she had been working at had closed down, and we connected on social media, and I had worked with her in the past, but she came into this role. Her name is Thea Burke. She was hired into a director of graduate nurse recruitment. So she, for the last year, has been embedded in our nurse recruitment team as a very experienced nurse leader who's been focused on how do we capture the new graduates, given all the competition, and quickly get them in and support them in their transition. So I can't say enough about Thea's role, and we're actually looking at expanding this to be also a role that would focus on retention. So a chief retention kind of role that would help us, again, engage with how do we think about mentorship? How do we think about, the different ways that we can keep nurses with us? So I can't say enough, and I know, Aman, you've worked.
Thea's phenomenal.
Yeah.
She's phenomenal. I think she's in the audience too. So the final question, just as we're wrapping up here, is, what are the top 3 tips you have for nursing leaders? I will say to the audience, we know we didn't get to all your questions. If you have more questions, please feel free to email us at questions@incrediblehealth.com, and we'll answer them. We'll help get Kate's answer to them. We're happy to help. So yeah, Kate, I'll leave that last question to you.
The last question, so while you have a nurse leader development program, how are nurses at the bedside developed for advancement?
Oh, no, sorry, Kate. What are your top 3 tips for,
We're doing
for
the top
nursing
3
leaders?
tips.
Top 3
I'm sorry.
tips.
I thought you wanted me to answer that chat question. So I'm going to start with one that I had mentioned earlier, which is around, as you think, or as we all think collectively about how we're going to continue to fight the good fight in this nursing workforce, challenging situation that we find ourselves in, that's going to be sustained for some time. It's so important to bring clinical nurses and frontline nurse leaders into the work that defines the strategy. They have to inform this. So I think that's critical. And I'm going to add one other caveat, which is I also want to make sure that we engage patient and family advisors. We have a patient and family advisory structure here across Jefferson Health, and I think it's important for us to get their input too. So I'll just add that. I would say a second tip, just in general, is these are really incredibly challenging and hard times. And we've already been through, as I described as we started, some really just difficult things as human beings. And so I would say, please prioritize your own self-care.
Yeah.
And I think for the leaders on the call, you set the tone. I tell my team, we're the standard bearers. If we don't use our PTO, if we aren't intentional about taking a 3-day weekend, if we don't end our day at a reasonable hour so we can go and give our energy to the people we care about most who live with us, then we're selling ourselves short. You've got to be able to recharge your batteries. So that would be a second. And the third is, I just want to underscore that this work absolutely requires, I'm going to call it an egalitarian partnership between recruitment, talent acquisition, and nursing. Yeah. Nobody owns this in a silo. We've got to come together and partner. We've got to take equal ownership of this. And I think it's critically important that we find ways to continue to integrate the nursing leadership, talent acquisition, and HR and how we think about workforce moving forward.
Absolutely. Kate, you have enough content and strategy and tactics to fill 10 webinars. This was, we just barely scratched the surface in this one. This was absolutely phenomenal. Thank you so much for your time and for sharing your insights and thoughts with everyone. And for those of you that want to follow up with questions, if you want to find out about Incredible Health, please feel free to reach out, and just really appreciate your time, Kate. Thank you.
I'm very honored to have been here. Thank you so much.